Hello and welcome to the A.J. Drexel Autism Institute. I'm Craig Newschaffer. I'm the Institute Director. This institute is one of 3 A.J. Drexel designated research institutes at the university. These institutes were set up to focus on research in areas that were especially promising and important, and we're delighted to be part of this initial trio. While we are an independent research institute, we do collaborate with the schools and colleges of the university. We really have projects going with virtually all of those schools and colleges. We collaborate with the College of Engineering right now on a research study that's looking at how light, incandescent fluorescent light, affects the sensory experiences of individuals on the autism spectrum. We're in conversations with our colleagues at Lebeau and the new Close School of Entrepreneurship on different ways to build programs to foster employment for individuals on the autism spectrum. So what these A.J. Drexel Autism Institutes are intended to do is not only have research programs that are based in the institutes, but also to reach out and to catalyze research throughout the university. And that's really an important part of what we do and a part that we take very, very seriously. The institute itself, our mission is to bring public health science and a public health approach to autism research. And we're really the first center to Autism Research Center to have that kind of focus. So a lot of what you're going to be hearing about in the rest of this little visit has to do with the public health focused research programs that we have based here. When you think about public health, what distinguishes it from a traditional biomedical approach is 2 words I like to put out there: prevention and population. Biomedical approach is often concerned with the mechanisms of a condition or a disease, and clinical treatment, how to take care of a patient that's in front of you. What we try to think about are strategies that prevent impairment from occurring in the first place, and ways to affect the largest number of individuals in the whole population. The whole population is your patient in public health. So what we'll be talking about today are our 3 core research program areas. We have a program area in modifiable risk factors that I lead. We have a program area in early detection and early intervention led by Dr. Diana Robbins, and an program area in LifeCourse outcomes led by Dr. Paul Shattuck. And you'll have a chance to meet Dr. Robbins and Dr. Shattuck in a few minutes, and I'll also get a chance to talk a little bit about the work that we do in the modifiable risk factors program. And at the end of the segment, I'll talk a little bit about how these 3 programs intersect and really sort of uniquely position us to address the challenges of autism in a very different way.
Hello, my name is Diana Robbins, and I lead the program in early detection and intervention at the A.J. Drexel Autism Institute here at Drexel University. I'm a clinical neuropsychologist, and a lot of my research to date has focused on the development, validation, and refinement of a screening questionnaire called the Modified Checklist for Autism in Toddlers. The MCHAT asks parents about everyday behaviors, like whether the child is interested in other children, whether the child points to show parents things that they're interested in, whether the child makes frequent eye contact with the parents, and types of communication, play, and social skills. When children show at-risk behaviors, it's really important for the pediatrician or other community service providers to refer those families for more in-depth evaluation and early intervention services. Research shows that children with autism who start treatment earlier have the best outcomes across their lifespan. The goal of our research program here at the Autism Institute is to offer those screening, diagnostic, and intervention opportunities to all children. One of our current studies builds off the foundation that we've established with the MCHAT research, and we're examining specifically whether 18 and 24 months are the best ages to screen all children for autism risk, and whether additional tools and additional methodologies like asking parents to answer the questions on a computer instead of on a piece of paper might improve the access that all parents should have to screen their children. Another study we're engaged in is involving several different community partners, including pediatricians' offices, faith-based organizations, and community agencies that provide services to low-income families. When children screen positive in this study, the community service provider monitors the referrals and the uptake of any intervention services for a period of months before the researchers confirm diagnosis. This allows us to examine what's really happening out in the field when people are using screening questionnaires. In the upcoming year, we expect to launch several studies that examine the screen, diagnose, and treat model for young children with autism, because research is showing that children who start treatment sooner have better outcomes across their lifespan. If you're interested in learning more about any of our studies or getting in touch with us, you can see our Getting Involved page at the AJ Drexel website. Thank you for joining me today. I'm Dr. Diana Robbins at the AJ Drexel Autism Institute.
Hello again, and welcome to the Exposure Science Research Lab. This is the only wet laboratory that we have in the Autism Institute, and this lab is part of the Modifiable Risk Factors Research Program, which is one of the 3 core programs here in the Institute. So what does the Modifiable Risk Factors Program do? Well, I mentioned before that one of the things that public health science is concerned with is prevention. And in the Modifiable Risk Factors Program, what we're interested in is seeing if we can discover exposures that could be avoided, and by avoiding those exposures, we can promote healthy brain development in infants and children. So to do this, to see if there are exposures that adversely affect healthy brain development, we need to be able to measure those exposures. And what do I mean by exposures? Well, exposures are a wide range of environmental factors. And when we think about environmental factors, yes, that includes things like chemical pollutants, but it also includes things that are related to our lifestyle. For example, if we're thinking about getting healthy brain development off on its best foot, maternal diet during pregnancy can influence how the brain develops. So what we in the Modifiable Risk Factors Program are interested in, and what this Exposure Science Laboratory is set up to do, is to come up with the best way of measuring these exposures. If we can measure these exposures accurately, then we can incorporate those measurements into other types of research projects. So let me give you an analogy. We've made tremendous progress in genetics research, and autism does have a genetic component to its etiology. We know that autism is heritable, and our colleagues in other research centers have spent a lot of time and effort trying to understand the complex genetic underpinnings of autism spectrum disorders. But at the same time, we know that autism is not all genetic, and that there are lots of these environmental exposure influences yet to be understood that impact the risk of autism. So to study these things, we have to be able to measure them. And if you're trying to measure complex environmental exposures, there are challenges. Take, for example, maternal diet in pregnancy that I mentioned before. Well, we can ask moms what they ate during pregnancy 3 years after they've given birth to their baby, and ask a lot of detailed questions, and moms can recall certain things, but we know that there are going to be challenges with the accuracy of that type of recalled information. Take air pollution, which was something else I mentioned, and is a topic of interest in research on modifiable risk factors for autism. There have been some data suggesting that air pollution might affect autism risk. How do we measure air pollution? Well, we can see where a mom lived when they were pregnant. We can link that up to data that the Environmental Protection Agency collects on air pollution and use that as a measure. But that's imperfect as well, because we don't know how much time that mom spent in that residence versus how much time she spent away. What the Exposure Science Laboratory is trying to do is to develop biomarkers of exposure. So the leaps that we've made in genetic research are largely driven by the fact that there was a revolution in molecular biology, and we were able to, as you all know, sequence the human genome. We can measure every nucleotide pair in an individual's genome. What we're trying to do here in this laboratory is come up with new ways to measure signatures of exposure in biological samples. So this machine here is a high-resolution mass spectrometer. Through this machine, we can take samples of blood, urine, saliva, and see if we can come up with accurate chemical signatures reflecting exposure to a range of things, from dietary constituents like how much folic acid is in the diet during pregnancy, to polycyclic aromatic hydrocarbons, a compound of a potentially risky compound in air pollution. So this is the work that we're doing in this lab under the direction of Dr. Snyder, and it's really, I think, path-breaking. If we can measure exposures, we can study them. And the way we study them, or try to study them, are in large epidemiologic studies, where we have samples of large number of individuals, some of whom have autism, some of whom do not, and we try to compare the exposure histories in those individuals to try to learn whether or not some of these suspected risk factors are true risk factors. And why do we do this? We do this because ultimately we want to know what these risk factors are, and we want to come up with recommendations or solutions for reducing these risk factors, whether they're public policy or recommendations that physicians can pass on to their patients.
Hi, my name is Paul Shattuck. I run the LifeCourse Outcomes Research Program here at the Autism Institute. We have 4 major research initiatives that we're pursuing in our program. But before I tell you about those research initiatives, let me tell you why we're doing what we're doing. Over the past few years, the research that we've done has discovered that despite the billions of dollars that have been spent in recent years on research and services for children with autism, when young people on the autism spectrum reach young adulthood, their outcomes are really not good. We find very high rates of unemployment, low rates of social participation, poor access to healthcare needed services. Across the board, indicator after indicator, young people on the autism spectrum are not achieving good outcomes. And we're trying to investigate why and make a difference so that outcomes are better across the lifespan and not just in childhood. For example, one of the things we do in our research program is analyze what are called national indicators. If you think of driving a car, you know what an indicator is. An indicator is something you see on your dashboard every day. There's the speedometer that tells you how fast you're going. The odometer tells you how far you've gone. Your map navigation system tells you whether you're getting close to your destination. Well, societies, states, countries, organizations have indicators also. You think of a balance sheet, think about the national unemployment rate. We rely on indicators to tell us whether we're reaching our goals. In the world of autism, we have very few good indicators at a state or national level. So what we've been doing is to try to compile and create indicators that can tell us whether all that money we're investing is actually paying off and creating measurable results that matter in people's lives today. Recently, we published our National Indicators Report on transition to adulthood. You can look it up online at our website. It's an exciting report insofar as it's the first attempt ever to compile data from different sources that paints a picture of how life is turning out, and it gives us that baseline information we need to understand going forward whether things are getting better for young adults on the spectrum. Another major program we're doing here in our research area is looking at what we call emerging practices. There's a ton of experimentation and innovation happening in communities around the country trying to develop new approaches, new programs, new interventions, new ways of helping people on the autism spectrum find success throughout their lives. We're trying to partner with these innovative social organizations and community settings to understand what they're doing, what's working, what's not working, so that we can fuel the discovery process to see what's working for whom and expand the range of options that help and create positive outcomes. We are about to launch a new website for our research program, the LifeCourse Outcomes Program, and if you go to our homepage at the A.J. Drexel Institute, you'll find a link there. It's going to be a house online for finding reports, infographics, blogs, a whole range of information products and exciting news about finding things that can make a difference in the lives of people with autism across their lifespan, because we know that autism doesn't disappear in adolescence. It's a condition that lasts a lifetime. And we anchor all of our work in the firm belief that people on the autism spectrum are valued members of our communities. They have dreams to pursue, contributions to make, and our research is aimed at discovering what those contributions are and how to unlock the potential of people to fully participate in the life of society. Thank you.
Well, thank you for visiting with us today at the A.J. Drexel Autism Institute. You've learned a little bit, I hope, about our public health science approach to the challenges of autism. You heard about the Modifiable Risk Factors program, designed to discover exposures that are potentially avoidable, and by avoiding those exposures, we can promote healthy brain development. You heard a little bit about the early intervention, early detection and intervention program, where our focus there is to figure out ways to detect autism at its earliest possible age, and then to promote effective intervention in the community for autism in those very young children. And then you heard about the LifeCourse Outcomes program, which is really about trying to maximize quality of life for individuals who are going to be living with autism throughout their entire lifespan. I hope it was informative, and I hope it illustrated the way a multidisciplinary research center like this A.J. Drexel Autism Institute can approach a complex problem and hopefully impact society for the better. Thank you.